Recording in progress.
Good evening, everyone. I am Sara Gattani, co-founder and secretary of GGMC Rise Club. I heartily welcome everyone for our very first webinar in the webinar series on research methodology. We are so glad to conduct this webinar in collaboration with GCMER, that is Global Consortium of Medical Education and Research, that aims to make research an integrative part of medical education in India. I'd like to extend a warm welcome to our speaker for today's webinar, Dr. Oshin Behl. Dr. Oshin Behl completed her Dr. Med from Germany after doing MBBS from MINER, Pune. She's the founder and president of GCMER, which is an organization that promotes research among medical students in India and now also globally. She has been the awardee of 4 international research prizes and has also been awarded a postdoctoral position in ENT at the University of Pardubice, Czech Republic. We are so glad to have you with us today, ma'am. We hope that we get to learn a lot today. Please feel free to drop your queries in the chat box and YouTube comment section. They'd be addressed by ma'am at the end of each section that she's going to conduct. So without further ado, let's begin. Handing over to you, ma'am.
Thank you very much. I hope I am audible to everyone. Just want to make sure because there seems to be some glitching, but I don't know if it's because of my bad internet or just like general bad internet. But yes, thank you everyone for being here. Thank you GGMC for inviting me for this first webinar of the research methodology series that you're doing. I think that's a very important thing. Considering how involved I am in research, you must already know how important I believe research methodology is for any medical student to learn. So yeah, without any further ado, I think I will be switching the order of the topics a little bit, as in I'll be starting with how to choose a research topic, and then I will be getting into the basics of undergraduate research and just be talking about some of the concepts that govern research. But I understand that many people here are already into research, but they are struggling with this question as to how to choose a research topic. So I'll be covering that first. Okay, now I have the screen sharing, right? So I'm going to share my screen. At any point during the webinar, if anyone has any questions, just write them down in the chat. I will be addressing them at the end of each section, like Sarah said, and I will try to address them as detailed as possible. How much time do we have for this webinar? 1 hour, I think, around an hour.
Yes, ma'am, 1 hour.
Yeah, okay, perfect. Okay, great. So now I will start. So welcome everyone. I'm just going to start with the topic, that is how to choose a research topic. And obviously I'm here as a representative of GCMER, but if you have any questions for me as an individual, if you need any mentoring help, then also you can always reach out to me. Don't worry about it. So obviously, if anyone gets into research, the first question they have is, where do I start, right? So is it with the questionnaire? Do I start making the questionnaire to distribute to everyone? Do I start writing the paper? Like, do I start writing the introduction and then I'll get to what to do exactly? Or do I start with learning the statistics? But the actual answer is the research question. You always have to start your research with a research question. So today, that's exactly what I'm going to be explaining to you in very detail. So today's webinar, like that's the first part of today's webinar. The objectives are coming up with a research topic that is valid, because I'll tell you about all the invalid research topics also, which are quite often chosen by students. Then we will be talking about a little bit of the role of literature search in choosing a topic and the 5 pillars of a good research topic, that is FINE. And there are two components starting with E, hence the 5 pillars. And also I'll be giving you a flowchart that I've made to help you with this. Also, I would like to request everyone to switch off their cameras because I know that decreases the bandwidth. The only reason my camera is on is because I'm presenting. So everyone can benefit from it if we just keep the bandwidth as ideal as possible. Okay. So now, as I said, there needs to be a research question, right? This knowledge gap, can anyone in the chat box write what you think a knowledge gap means? Okay, because this is not a lecture. I'm trying to understand what you need so that I can give it to you, right? So tell me what you think a knowledge gap means, okay, and we can discuss that further. So a knowledge gap is basically any absence of knowledge in any area. Okay, so any area of lack of information in the scientific field, to be more accurate, is basically a knowledge gap, right? For example, now coming to the actual examples related to research, are there any absence of information about the prevalence, the incidence, the diagnostic process, the symptomization, the complications of any disease? Right? More often than not, you will notice that 80% of research is basically just this. It's about exploring these questions. But even if these questions don't exactly pop up and you feel like, everything is saturated, people know everything about everything, that might not be true, because then come the sub questions, right? All of this can be looked at in a geographical area. For example, if the prevalence or incidence of a certain disease is known all over the globe, but it's not known in India, it's not known in Maharashtra. Now, that doesn't mean that it's unimportant. It's just that no one has actually looked at it, right? So you might look into that. Then it can be found in a certain age group, right? Any disease, some diseases, we have found that they have a biphasic occurrence, right? So if anyone can write in the chat which disease they think I'm talking about, which has a biphasic occurrence, that is, it's found in very young people and very old people, and not in the middle age group, right? You can write it down, whatever you think I'm talking about. So if someone had not begged the question and said, I want to understand what the prevalence of this disease is in a certain age group, then maybe we wouldn't have ever found out that it's true for that age group. Then it can also be found in a certain occupational group, right? Like according to professions, for example, coal miners have been known to suffer from a higher rate of lung cancer, right? So things like this, it can be anything. One second, there's this notification that's like blocking my view. Okay. So then the next question, after understanding if there's any sort of question that you have in your mind, the next question you need to ask is there any previously done research that fails to answer that certain question? Because you might think of a certain question and you might think that it's important, and it very well might be, but there might be other research that has already explored that question. So you need to understand what your research gap is exactly, and not just think of it in a theoretical way, but actually look at what research has been done in that area. Now, this can be from your subject of interest. For example, in second year, I was really interested in pharmacology, and I decided to pursue my research in the field of pharmacology. Or it can also be in a subject that's taught by a student-friendly professor. And the reason I am highlighting all of this is because you might be really interested in a research topic, but at some point during that journey, you're going to need a mentor, right? So if, for example, you are struggling with finding a research topic, you can always try to focus on the subject that is taught by a professor, or if you have a mentor who is really student friendly, who will be willing to guide you in that process, and that will be really helpful. And we underestimate that, but that matters a lot. That's why I've made sure that I've highlighted over here. But to go from this knowledge gap to the actual research question is still a question, right? We don't know how to exactly do that. How do we convert this knowledge gap into a valid research question? Because we can have a knowledge gap about various diseases, various conditions, various processes, for example, in biochemistry. But how do we convert that into a valid research question, which we can actually explore? So the question you need to ask is this gap coverable, right? Is this gap going from a knowledge gap to a research question actually coverable? And what we mean by that coverability, that's not a word, by the way. What we mean by that is feasibility, right? The feasibility of your research topic. And this is actually the F in the fine, okay? Your research topic needs to be feasible. But there are different kinds of feasibility that you need to look at. The first and most important one, I would say, at least for undergraduates, because we don't have the access to clinics as much as doctors themselves, is sample feasibility. That is, can I reach the sample size that is required to conduct this research, right? If you can't reach the sample size, then that research is dead before it has started. So first you need to explore that. Can I reach the sample size? The second is temporal feasibility, because let's face it, undergraduate folks don't have a lot of time. I didn't have a lot of time. I was constantly on deadlines. We constantly had exams coming up. Sometimes we had these conferences coming up, which I really wanted to participate in, and I didn't have anything to present. So obviously, temporality is an issue. And for that, you need to make sure that you have enough time. And also, if you choose a topic that is too long to be dealt with, for example, if as an undergraduate you decide to do a cohort study in which you're going to be observing people as they go on and not be looking at the final result itself like you do in a case control study. So in the case of a cohort study for an undergraduate, what happens is that it requires a lot of time. It might just happen that when the follow-ups need to be done, you have some exam coming up, right? You didn't look that much into the future. But at that point, what happens is that your research becomes invalid because your research design is not being satisfied simply because of your schedule coming in the way. So that does happen. That's real life, right? So you need to think about all this when you're thinking of a research topic. The third thing, obviously, is participation feasibility, because you need to make sure that people will be willing to participate in your study, because they need to be motivated to put the efforts to participate in your study. For example, if it's just a questionnaire, okay, it's a questionnaire-based study which you're going to be doing online. Usually we do say that questionnaire based studies are easier, so they don't really need an incentive. But trust me, I have had so many students tell me that nobody's filling out our questionnaire. That's because they don't have an incentive to do that. Why will they take out even 5 minutes of their time to do something for which they have no incentive, right? So you need to think about all this when you're choosing a research topic, because it can make or break your research. So to solve all of this, for example, for sample feasibility, what you can do is you can talk to your professor, find out if you have patients of that whatever topic you're thinking of researching, right? If you're thinking of doing a clinical study. For temporal feasibility, I always like to say that try to stick to studies that require maximum 2 months, because anything beyond 2 months, you and I, we all know that medical exams come and go as they please. Every 3 months, we have some exam or the other. We have some practical, we have some external exam. So to make sure that your research is not affected by that, I always like to stick to the 2 month schedule from start to finish. I'm not saying the paper writing part, but at least the experimental part, at least the study part. And if, for example, I would not suggest this all the time, but if you have a particular conference for which you're submitting, obviously you can back calculate from the submission date. Sarah, do you have a question?
Sorry, ma'am. I'm so sorry to interrupt, but your PPT is stuck on the first slide itself. So have you changed
First
your
slide? First slide? Oh my God.
I just felt it.
Okay, wait. Wait. Can you see it now?
Yes. Where do I start?
And then the objectives?
Yeah.
Okay. Because I was getting a message that said screen sharing paused, please bring it to the front or whatever. But when we were doing the tech check, the same message had come up, and then you had said that like you could see it, right? So I thought that
it was visible there.
Yeah, maybe there's no issue.
I'm so sorry to interrupt your.
No. What I can actually do is I can just stick to like presenting it like this, because I think that the moment I'm doing this, yeah, it says sharing is paused. So I'm going to not do that because I want people to see the PPT. So yeah, I can just present it from here. So basically I covered this knowledge gap part. And yeah, I was talking about the feasibility, right? So I hope that everyone understood what I was talking about, because actually when I made this PPT, it has a lot of this animated stuff on the screen where it needs to go point by point, but like yeah, I don't think that's possible now. So yeah, I'm going to try to fix that. Let's see. One second. I'm just going to go to a new share and I'm going to share my entire desktop and see if that works. Right? Maybe that'll work. Yeah. You can see my screen now, right?
Yes, ma'am.
And you can see what I'm doing.
The animation. Yeah.
Okay, so I was talking about feasibility, sample feasibility, temporal feasibility, participation feasibility, and then I was talking about how to solve these problems, and that's where we were, right? Like I was talking about how you can actually solve these problems and how you can make sure that your topic is finally feasible, right? And for the participation feasibility, of course, if you have funding, then you can provide incentive as the funding itself. Or, for example, we had a few residents in our college who used to have these ophthalmology medical checkups, right? They had these health camps. So during those health camps is when they used to do most of their research. Like during the health camp itself, they used to pass out questionnaires because people were getting free health checkups. So that was a kind of incentive, and that is very valid. There's nothing unethical about it because you are providing a service, and at the same time you have their participation, right? So you can always do that if you want to. So next, yes. So now we have a feasible research question, right? Now we need to move on to a unique research question, because you can have like practically speaking, a topic might be really great, and you have the patients, you have the feasibility, you have everything you need, but at the same time you need to ensure that your topic is unique, right? Because a unique topic leads to unique research, which leads to appreciated research. And we all want our research to be appreciated because it does take a lot of effort, right? So now how do we go from a feasible research question to a unique research question? So the answer to that is manifold. The first part being a literature search, right? And what role does this literature search play in your research? So a literature search basically helps you answer the basic questions like whether this has been done before, how, where, when this was done. For example, if you have any sort of research related to disease, related to methodology, related to mechanism behind a disease, if it has been done way back, okay, let's say it was done in 1999, and now you are thinking of that, you had that unique question, so you can still do it because medicine is evolving, right? So now we have better methods to evaluate things, and that's why it might be very well valid for you to do that research now, even if it has been done before, as long as it's been done way back. And when you do this literature search, you also find out what they found out, right? The other people who did this research in the field that you're looking for, you found out, for example, if you found out that they looked for something and they came to a negative result, okay, they had the same question as you, but they arrived to an answer that's different from yours. So the first thing you can do is you can pivot, right? You can change your topic, and you can think, okay, like this is already done, they didn't find what like I'm expecting, I can move on. The second thing you can do is you can critique that paper, right? So you can actually assess that paper for any sort of flaws that they might have in their methodology, in their statistics, in their sample collection, in the way they ask things. Were there any confounders that they haven't really highlighted, because of which they got a result that you were not expecting, right? So there are so many things which you can find out from a literature search, which can help you in choosing your own research topic. And the sample required also actually is derived from previous papers, right? So for example, if you are doing any research that is absolutely new, most of the time that won't be the case, but if something is absolutely new, you go with the standard 30-30 rule, in which you say that a minimum of 30 participants is required in both the case and the control group, or in the interventional and non-interventional group, and you just go with that, right? 30-30. But if, for example, for any study that has been done previously, you can actually derive the sample required for your study based on this simple formula, which we actually all learn in PSM. I don't know how many people over here have already finished biostatistics, but we do learn this in PSM. But for that time, it's just jargon, right? Like, because we learn so many formulae, and we don't know which one is the most useful, which one to use where. And that's exactly why sitting for these webinars is sometimes useful. I'm not saying it's always useful, but sometimes it is. So, for example, for any cross-sectional study, you can choose the sample size based on this simple formula where n is equal to z square p 1 minus p upon d square. Okay, and p over here is the prevalence that they found in the previous study. Z over here is I think it's the power of that study, and d over here is the difference, right? Like what they used in their study itself. But yes, I'm not a biostatistician. I just know my basics, and it's enough to do my research. But no, I'm not a biostatistician. But what I'm trying to highlight is that you need to know the practical aspects of what you study in biostatistics because it is useful. So don't just ignore it. So now, of course, I've told you how important literature search is, but where can you do it? So you can always do it on these databases, starting from Biosis to Sinhal to Cochrane, Embase, Medline, PsycInfo, PubMed, Social Science Citation Index, and Web of Science. But I can tell you that my go-to place for doing literature search is PubMed. I only refer to PubMed. At the most, I might go into ResearchGate or Web of Science, but most of my literature search is done on PubMed. But that's a completely personal preference. Many people have different preferences. For example, people have different preferences in research when it even comes to citations, right? Like I use Zotero, people use Medley. Right, so it's different and it's not very specific. So as I said, my go-to is PubMed, but I do use Google Scholar, ResearchGate, and Sci-Hub. And Sci-Hub has a very controversial history, which is why I don't always talk about it. But so Sci-Hub is basically this database where people have put in papers which are usually not accessible to the public, right? You need to have either like a very costly subscription to a journal, or you need to buy it, where buying it for 24 hours is going to cost you like $50. And like, we are poor, right? Like, at least I am poor. As a student, I was poor and I didn't have that kind of money to put in. And that's where Sci-Hub is really useful. But they keep shutting down and opening up simply because of the fact that most journals don't want their research to be put up on Sci-Hub. And yeah, they get into trouble for that. But it's useful. So now the next question after doing the literature search is, how important is this, right? Because if it's not important, it's not going to be unique, right? Even if it is unimportant and unique, nobody is going to care about your research, because you can research about the most mundane things here and there, but that doesn't make your research good, right? So it needs to be important. So the questions you need to ask is, will this help another researcher in the future? And this question seems very simple, but at the same time, it can help you make a lot of decisions in your research. For example, if you are doing your research and you are in your preliminary stages of interpreting the results, and you figure out that I'm getting a negative result, right? Like, I am not getting the result that is in line with my null hypothesis. This is completely different. I don't know why. According to me, 100% I would have gotten a different result. So do you publish it or do you just scrap it? That's the question, right? Like, do you publish a negative result or not? And the answer to this lies in the answer of this question. Will this help another researcher in the future? Because if you have a negative result and it helps another researcher in the future, it is very well worth publishing. And you should publish it, because some other researcher in the future might be doing a literature search on the same topic, and they might come across your result and say, okay, so this researcher found this. Let me figure out why they found this. Or maybe what I was thinking was wrong. Because, and I'm going to come to this in the next section, whenever you come across any sort of result that is deviating from what you thought was going to be true, always go with the statistics rather than the anecdote, right? Because it might be true that in the 3 or 4 patients you found something, but in the research you're finding something else completely. So you have to be humble enough as a researcher and a clinician to accept that, okay, maybe what I was thinking was wrong, and this research that I'm looking at is right. So you need to make sure that you do that. If your research has direct clinical implications, of course, it's very important. But at the same time, there's something called basic research, which doesn't have direct clinical implications, but it is going to help clinical research. So that's what I mean, that at the end of the day, it has to help the patients, because that's what we are here for, right? And just because it hasn't been done, and if you don't find it out on the literature search, it doesn't mean that it needs to be done or it's necessary, right? Because many students, they look at the literature search and they say, wow, like, I came up with this topic and oh my god, nobody has ever done this before, like I am going to be like the next Nobel Prize winner. But the point is that just because it hasn't been done doesn't mean that it needs to be done or it's necessary, right? Like that's the N of the FINE, right? The necessity is also important when you're choosing a research topic, and these questions can help you answer that. And if you find that it's not necessary, just don't do it, because you can have these research projects done, but at the end of the day, if it's not helping patients, don't go for it, is what I always suggest. So you've made sure that it's feasible, that it's innovative, and that it's necessary. The next thing that you need to make sure is that it's ethical, right? Because any research involves bioethics, and like I'm part of this other conference that's going to be happening. It's exactly what we were discussing, that we don't need to limit the submissions to be from the field of bioethics, because any research actually needs to be ethically sound. And I'm sure that all of you must have gone through the ethical committee clearance if you have done any project, and understood how important it is, at least to your institute, if not to you. And that's because if anything goes wrong, God forbid, if anything goes wrong, then it's going to be you who's going to be on the chopping block, and it's going to be the institute. And that's why they need to make sure that your research is ethical. But as I said, the E stands for 2 things. So if there are any guesses about what the second E is, and trust me, it's going to sound really bizarre that I even think that it's important, but it's very important that apart from these boring things like, like clearances and approval and data collection and data entry and statistical formulae and all of this, because all of this you are going to come across during your research, and you might be really excited about your research, but if you are not excited, then all of this is going to deter you, right? Because this is boring stuff, and I'm going to admit that. Like, I'm not always excited about my research, but I have to make sure that I am enthusiastic about my research, right? Because if I'm not enthusiastic about my research, I'm not going to give it my all. And that's exactly why I have always been very anti giving topics, like, because there are students who just want a topic and they're like, okay, you know what, just give us a topic, we are going to do the research on this and we can have our publication. But I've been through that. I have been the student who was given a topic, and I've also been the person who has given a topic to a student, and it never works out. Because if the student is not excited about it, they don't give it their best. At some point during the research, they just give up, right? And that should never be you. And whenever I am doing a project, I make sure that I am excited about it. My mentor is excited about it. And that's the only way you can keep going, because it can get really boring, trust me. So just make sure that your research topic excites you, right? So to summarize all of this, that is the first section of today's webinar. The feasibility, the innovativeness, the necessity, the ethics, and the enthusiasm are all very important when you're choosing a research topic, right? And even other than this, I've created this flowchart which you can use to just choose your research topic, which basically tells you, like, like a feedback loop and everything. So it might help you, and you can take a screenshot of this. I don't mind, this is not copyrighted or anything, just don't use it in any of your videos. But I'm sure that the quality is not good enough to be used anyway. But just go through this and make sure that you're making sure that every step is leading to the next step, and that you're not skipping any steps, right? Because if you have a topic, for example, and wait, how do I use the pointer? I don't know, I'm just so old. I can annotate though, right? Yeah, I think I can annotate. Where's the pointer? Wow, I'm so confused. Anyway, so if you go from the top, that is whether there's something you're wondering about, and you just jump to whether it's ethically sound, right? You haven't gone through whether it's feasible, you haven't gone through whether it's necessary. You don't have a research topic then, because you might find out that, okay, like I have submitted to the ethical committee and oh, it's great, like they say that your ethics are well in place, but if it's not feasible, if it's not innovative, you don't have a good research topic. And that's what you need to remember. So if you go through all of these steps and you do find a research topic, please feel free to reach out to me and tell me that, oh, you know what, I went through all these steps, found a research topic, tell me if it's good, or tell me if there's anything you can help me with. I'll be happy to do that. But just come with a research topic, because I have this video, honestly, like a different version of it, of course, on the GCMER YouTube page, and now it's also going to be on the GGMC Rise YouTube page. So I expect that much effort, at least, that you at least do that. Don't come to me and say that, you know what, I want to do research, make me do research. I'm not going to hold your hand and do research for you. You have to put in that much effort and show me that you're actually interested in it for me to even take interest in you as a mentor. And trust me, this is not just true for me, this is true for anybody you approach. Don't approach them with an empty slate. Approach them with whatever you have done to show that you are actually putting in effort, so that they have something to put effort in for, right? Okay. Now I don't know why this is not moving, and I think I need to, like, wait, how do I like stop annotating? Screw it. Okay, wait, what's happening? Wait, I'm so sorry, guys. I'm just so bad with this Zoom stuff. Because my mouse is just like not visible on the screen. See, you see that? I think even you guys can see that it's just like highlighting stuff. I can't really see anything. Just going to use the mouse. See, now I can't even see the mouse. Wow. Okay, good. So, any questions before the next section? I'm of course going to go through the chat, and I'm going to see if there are any questions. Okay, so I'm just going to go through the questions in the chat box. You guys might have already read it. So Yes. Okay. So someone says, still in the process of learning medicine and not well acquainted with what topics are of interest in research. So, see, this thing can mean two things. Either you're in the first or second year of medical school, and you're not really sure what people are researching about, or you're still in the process of medical school at some point and you don't know what interests you. If the question is the second one, then I'm sure that this webinar would have helped you. But if it's the first one where you're wondering what people are researching about, there's a very simple solution to this. Just go on PubMed and look at the recent most papers. Trust me, it helps a lot. Reading through what other people are doing sometimes inspires you to do what you want to do, and that can also be one of the ways that you go about your research. It doesn't always have to be like pure innovations. It can sometimes be something as simple as just going through other people's papers and understanding what they have researched about to understand what you can do as well. Listeria meningitis. Okay. If one controversial research like COVID positivity in neonates, then what to do? What do you mean by controversial research? What does that mean? I'm confused. Because COVID positivity in neonates is not controversial at all. If as long as you're working, as an intern, or if you have any sort of postings in the NICU or the PICU, then you can definitely go for it, because like then you can understand the prevalence, but it's not controversial at all. You can do it. Okay, ma'am, can you describe any one of your research papers, how you started until the end, how it all worked out? Yes, I will give you my Instagram. You can always go to this Instagram, that is GCMedEduRes, and you can text us there, and I respond to all texts because I have access to that Instagram, and I do that. Ma'am, how can you do research in surgery? So for doing research in surgery, there are different ways to go about it, because surgery itself, like, of course, the method of doing something can only be researched about by someone who is a surgeon, right? Like if you're a student, you can have a question about it, but you can't go about that research because you don't have the license. It's as simple as that. So what some research projects that I've seen around surgery are related to either the pre-op part or the post-op part. For example, if you do research in wound healing, right, that's one very important part of research, because it has still not been understood very clearly. Of course, we have the different categories of wound healing and how fast it heals, but it has not been understood, right, very properly. And the more data we have, the easier it's going to be for us to understand. So you can go into that, go into like wound healing research. Or when you say surgery, I don't know if you mean specifically had to like deal with meningioma samples, and it was really great because I could be there when those meningioma samples were being taken in the OR, and I assisted in that, and it was great. But yeah, you can always do that. So yeah, you can do a lot of stuff in surgery. How do we consider time? Should we think about completing all the steps in 2 months span? Yeah, when I say 2 months span, completing all steps, I don't mean, like starting from choosing a research topic and all of that. Once you have your research topic, okay, once you've decided this is what I want to do, and you have ethical approval and you have all the approvals you need, Then from that point on, I would say a 2 month span is good, because in the 2 month span, you have to work on it, right? Like you have to stick to a schedule in which you are going to have to contribute your time to it. So that's why I always say 2 months. But of course, this is a very arbitrary timeline. It worked out for me, might not work out for everyone else. Some people prefer to do their research in, like, gaps. They do 2 months and then they take a break and then they do 2 months. So you can do that as well. Oh, you couldn't hear me. Could everyone else hear me? I don't know. And I think she exited also. So I don't know. Maybe it was just like a glitch. For a student with not much support from teachers, what other methods are other than the questionnaire method? You can always do original research through the questionnaire method. You can write a review, sometimes in collaboration with students from other colleges where they do have guidance, so that you get their guidance. You can also do case reports, which really help students because it involves students into the clinics, and that can be helpful. FMG, how can I do research? See, if you're an FMG, then research is very, very important for you, like, because you have to get into, USMLE or UK or wherever. So how can you do research? I don't have an answer for that, because I've explained the choosing the research topic part and everything. And yeah, that's how you do research. Okay. Very much interested in research, have no clue how to do. How can I start? Should I do it myself, team, or resources? Okay. As I said, I've given you everything you need to choose a research topic. Beyond this, I can't hold anyone's hand and tell them that, you know what, this is how you do it, that's how you do it. But I've given you all the resources. Now it's up to you how you use them. And that's going to show me that you're actually interested in it. And if you are truly interested in it, you're going to approach me with a research topic and ask me what's wrong with it. Then I can definitely help you. I can help you by doing my own literature search. And yeah, I hope that's useful. But I can't tell you how to do research. Like, I am not that qualified. Okay. Has not approved to do any research about this. Yeah, so when you say that you want to do research about COVID in neonates, and you're saying that the government hasn't approved to do any research about this, what the government has not approved is that you cannot do any experiments. Okay, you cannot do any intervention in neonates with COVID. Why? Because there isn't enough data about how they are going to react to it, how they are going to respond to that. And of course, research is not worth any life, right? So that's why the government hasn't approved that. But the government hasn't blogged any sort of prevalence studies on this. Okay, they cannot, right? Because we are the ones who are seeing the neonates with COVID, or we are the ones seeing the vertical transmission whenever we are working. So of course we can research about it, we just can't intervene. That's all. And make sure that the data is anonymous also. Small scale research project, best ways to upload a research project. When you say upload, do you mean publish? Just clarify that to me and then I can answer your question. How do we specialize in research in urology? If you get into urology as a resident, of course, you can do a lot of research. Another way to go about it is doing a PhD, because clinical PhDs do exist. Even if people don't know about it. That's just because India has this tendency of degrading MBBS doctors, and that's absolutely untrue. As an MBBS doctor, if you have a PhD and you are getting into research related to that, you can actually start a clinic for diagnosis of urology-related conditions. And that's absolutely possible. So you can definitely get into a PhD of some kind in any specialization. Ranking of journal paper in India, how can we get it? Yes, there is. You just need to go online and Google it, honestly. Like you can just, because journals can be ranked according to different things. Most often they are ranked according to impact factor. I don't believe in that whole ranking, but that doesn't mean you shouldn't. It's just a personal opinion. But yeah, you can just look for impact factor ranking India and you'll find it. Avoid which is redundant, unsuccessful in the field of research. What if the conclusion and aim disprove a subject of your own specialization? That's okay. Will medical journals expect influenced by corporations? Yes, some journals are influenced by this sort of thing. It's the real world. You can't really help it. But if any reputed journal you submit your research to, any reputed journal, they will accept it. Okay, starting from BMJ for students, or even any JM, if you're able to submit it over there, they will accept it because they get their funding from sponsors, right? And those sponsors have to be non-scientific sponsors, or they have to be like general sponsors. Like any medical company can sponsor a journal, but if there is a company that specializes in something and doesn't want something to be disproved, all that doesn't work, like for all the reputed journals. Okay. Allowed to investigation on patient by ethical committee. Yeah, you can approach an ethical committee and say that I want to do this project, but they are going to request you to get a mentor because they don't want to directly be in touch with you because that's just more work for them. That's all. That's why you need like a professor or someone who is a mentor from your college. That's all. How to decide on which method to choose for a long-term research? I don't know how to answer that because when you say long-term research, do you mean like, do you want to get a doctorate in that subject? Or by long-term, what is long-term? Like, what is the timeline? Is it 1 year, 6 months? I don't know how to answer that. Which research topic will make my CV perfect for USMLE exam? Any research topic. Doesn't matter. As long as it's innovative and it's not one of those typical things that the departments in your college make you do, to get publications in that department, because any person, any doctor abroad who is worth their salt will understand in a minute that this was like a departmental project and like you had nothing to do with it. You just have it in your CV. So anything that's innovative, anything that you've done yourself, put it on your CV. It doesn't matter. What is the scope of research in subjects like anesthesia, radiology, dermatology? A lot. In any medical field. A lot. For really quite new. Thank you. Okay. Publish. Okay. Publishing is a different aspect. Honestly, I feel like we're running out of time already. Like we've completed the time and like I'm not even across like the halfway. Oh my God. GGMC Rise is going to kill me. But yeah. So yeah. Too many questions. Sara, I need some administrative intervention from you. Should I answer all these questions right now? Should we go on with the webinar? Because it's like 6 o'clock. What should we do? What's the protocol?
Ma'am, it's your call, frankly. I mean, if because it's interesting and a lot of questions are coming around the same thing. It'll be great if you don't repeat the questions, but otherwise, I think you can address them. It's okay.
Yeah. But what about the second part? Because we have a second part remaining. Yeah, so what should we do about that?
So shall we take like 2 more and then stop?
Yeah. I can take the questions. They're like ending. That's not an issue. But I just wanted to like clarify with you.
Could we move ahead with the session and come back to the questions at the end so that people who want them answered can stay back and like the others can leave?
Yeah, that makes more sense actually. Yeah, perfect. Cool. So okay. I am going to move on to the second part. And in the meanwhile, if anyone has any other questions, feel free to write them in the chat box. Because the second part is just like an overview of research and just going through stuff that's not really spoken about. And it might be boring to some people, and that's okay. I understand that it's boring to me also sometimes. So yeah, I'll just run through it because I don't want people waiting on a Saturday evening. I understand. So, okay. So now coming to the overview of research, which is basically like what we wanted to combine with how to choose a research topic, because, like there's no point in knowing how to choose a research topic if you don't know what research is, right? So for anyone who had put in that, like I'm very new to research, just started research into medical field, but don't know what research is, this is for you, okay? So going through some of the topics that were suggested to me after I had done this how to choose a research topic webinar for students. The first one of the topics was, is PUBG bad for students? Okay, I know, very controversial. I don't think it is available in India anymore. I don't know. I don't play PUBG. One of the other topics was bad marks and depression. Okay, that's it. That's all they told me. Bad marks and depression. Which way to go? This way, that way? Nothing. Just bad marks and depression. The other topic was WHO guidelines for COVID, because I had done this webinar originally in the beginning of 2020, and obviously, like COVID was really hot at that point. Of course, now we know all of this, but back then, this was one of the topics suggested, and I'll tell you what is right and wrong with each of these topics when it comes to considering them to be research itself. That begs the question, right? Like, what is research exactly? So today in this, we are going to be discussing an introduction to research, steps in research, and research in general, right? So research is a process of solving problems and resolving previously unanswered questions, which is something that we saw in the previous part of this webinar, right? We are answering previously unanswered questions that can be in a niche or it can be a general question, right? Then sometimes my PPT just gives up. Okay. So I was talking about how you need to go from this knowledge gap to a research question, correct? So when you are going from this knowledge gap to this research question, there are some things that you need to remember which makes research, right? Sometimes people say they've done research, but it's not really research. Like all the people on social media who you see saying that I have done my research and I've understood what this works like. No, they haven't. They've done a literature review. Right? Now you can tell them that that wasn't research. You've just gone through data on it, and that's not research. So now coming to what makes research. The first thing is research needs to be systematic, right? And I don't mean to sound like a Virgo, but it needs to be systematic. And that's something that a lot of people forget, that it's a structured activity. It needs to go from a starting to an ending, and you can't skip steps in between. You start with defining variables, constructing hypotheses, and developing research designs, right? And all of this needs to be done in a systematic manner. For example, if you make a questionnaire before determining the expected outcome, then you have failed before you have started, because you might put out a questionnaire which fails to ask a few questions, right? And then in the end, when you're making the correlation between the results you found and the demographic data or anything like that, you will fail in achieving the result that you needed to achieve simply because you skipped a few steps and you were non-systematic, right? Which is why you need to ensure that you're systematic when you're doing research. Now, this topic, bad marks and depression. What makes this topic a bad topic is because it doesn't go in a certain direction, right? Are we asking whether bad marks lead to depression, or are we asking whether depression leads to bad marks, right? And when you're doing research, you need to make sure that you're logical. And by logical, what this means is that it needs to go in a certain direction, right? So there are different kinds of logic which you can apply in research itself. And the first one is inductive logic, right? In which now I'm going to present like a small case sort of thing in which you can understand what inductive logic exactly means, because it's like a big word that you haven't heard before. Most of you, I'm assuming. So, for example, a COVID patient was found to have lung opacities. More COVID patients were found to have lung opacities. Okay, so now you are forming your research question slowly. Okay, so lung opacity is seen in COVID, right? It's as simple as that. You found one person, that's an anecdote. You found multiple people with this. So what is this? It's like a prevalence study, right? Because lung opacity is seen in COVID patients, and that's an inductive logic because you're going from the base to expanding it, and that's how you're achieving your conclusion. This inductive logic, it can be invalidated, but it can never be proven. Why? Because of the simple thing that you can never test all COVID patients, right? But if you come across a few COVID patients who don't have lung opacities, it will be invalidated, right? That COVID patients have lung opacities, right? So that's why this is called an inductive logic, and it can be invalidated, but it can never be proven. The second kind of logic is a deductive logic, right? And the way this is different is that we go in sort of the opposite direction. We go from saying that lung opacity is seen in COVID, and if a person is COVID positive, they will have lung opacity. So we are slowly narrowing down our conclusion, which we were basing on a generalization. Then what we do is try to collect data, that is chest x-rays of COVID patients, to understand if what we thought is actually true, right? If less than 950 patients out of 1,000 patients that you have collected data on have lung opacities, then you reject the null hypothesis, because what you see over here, lung opacity is seen in COVID, which was the first step, is basically a null hypothesis. And this is very important to learn what we mean by a null hypothesis. A null hypothesis is basically a statement that you've made based on theory. Because the theory is that COVID causes different lung problems, and lung opacity would be seen in COVID, right? That is the theory. But once you have tested it on, say, a sample size of 1,000, and you want to have a power of 95%, and these are different things that we might have come across, but we never understand, like a p-value of less than 0.05 makes something significant. And if the p-value is more than 0.05, then it's insignificant. This is exactly what it means. In this case, we are making sure that the p-value, right, is less than 0.05. That is, less than 50 people are actually going away from the hypothesis, right? More than 950 people are fitting into the hypothesis, and that means that this result that you have obtained is significant, right? The difference between an inductive logic and a deductive logic is that for an inductive logic, you don't need a database. You don't need multiple people. You don't need a significance level. You don't need a power. You just need a statement, and you need to either disprove it or it just stays there without ever being completely proven, right? That's the difference between a deductive logic and an inductive logic. And research follows deductive logic, right? This is what we follow in research. We have a theory, we have a hypothesis, and then we try to arrive to the conclusion by doing valid research, right? The conclusions will be true. That is, this conclusion that we have found out that, lung opacities are seen in COVID patients, they will only be true if the premises are clear, right? And by premises being clear, what I mean is that, are you looking at COVID patients who've had COVID for a week, 2 weeks, a month, who are post-COVID? Do you consider them to be COVID patients? So all of these things need to be taken care of, and only then can you accept or reject the null hypothesis, right? Boring stuff, but very important to understand, especially if you're planning on reading research papers and trying to come up with conclusions that can help you with your own research, right? Now, is PUBG bad for students? Okay, this research topic. Let's just explore this. What this research topic asks is PUBG bad for students? But is that a philosophical question or is that a research question, right? Because they are both logical disciplines. And trust me, more often than not, many people might be asking a philosophical question which is looking like a research question. Now, how can you differentiate between a research question and a philosophical question? Research is always empirical, okay? What does empirical mean? Empirical basically means that it's based on data and not personal experiences, right? If that question, is PUBG bad for students, was asked as a research question, then I would collect people who play PUBG, who are medical students, see its effect on their mental health, see its effect on their academic performance, and then come to the conclusion with the help of the data. Who knows? I might actually find out that it's helping their academic performance, right? So that's why research can always surprise you, and it's empirical. If you ask that as a philosophical question, you can always say it's bad for students, because it's intervening with their studies. But research doesn't do that. Research is very unbiased. And that's something we need to remember as clinicians. This empiricalness of research actually makes it very difficult for physicians to do research. As a scientist, if you have done BSc, MSc, then you're used to that world where you aren't jumping to conclusions based on anecdotes. But as physicians, we very often come across patients who might show a certain symptomology or come from this diagnosis to this conclusion based on multiple patients. But that might not be true according to data. And whenever that happens, when you are confronted by data that doesn't support a hypothesis, discard the hypothesis, not the data, right? That's why it's called a null hypothesis, because it can be rejected. It's not 100% true all the time. And whenever this happens, you need to remember that you need to discard the hypothesis, not the data. And this is exactly why negative results are results. And you need to make sure that you are making sure that the results are being published, right? Another aspect of research is that it needs to be replicable and transmittable, right? And when I was saying about publications and all that, I was talking about exactly this. Replication validates data, right? Whenever you're doing any research, why is it that we write the methodology in such great detail and we go from each tiny detail to the next to make sure that anyone who is reading your research understands how you did it, right? You cannot produce bogus results and say that this was my methodology, because someone should be able to replicate your results using your methodology on that population, right? I'm not saying that they might take up a different population and then do the research using your methodology and say, oh, we didn't find that out. That's different. That's a different population. But I'm saying that if it's on the same population, it has to be replicable, right? And that's why you need to make sure that your methodology is elegant. Now, what do I mean by transmissibility? Transmissibility is presenting your research in conferences, publishing your research in journals. That's what transmissibility means. And that allows subsequent studies. If there weren't these studies which you found in your literature search, by which you came to how to choose a research topic, you wouldn't be doing that research, right? And if you don't publish your research, someone down the line, 5-10 years from now, might not be able to do what they need to do. And we might just go 10 years behind, and they might just try to repeat what you did and come to the same conclusions, which is exactly why transmissibility or publications are very important, right? Now, when we talk about this research and data, it's very important to collect data, right? But what if it can't be generalized? Which is what I meant by replicability, right? If you can't replicate research and it cannot be generalized, then your research is invalid, which is exactly why we have things like p-value. And a low p-value basically ensures that it's generalizable, right? If it's not generalizable, then it's not valid, because research should contribute to generalizable knowledge. Because someone sitting in the US, if you have written a paper about diabetes in general, okay, then someone sitting in the US should be able to benefit from that data. If you have written about diabetes in India, then someone across India should be able to benefit from that information, whether that's a patient or a clinician, right? And that's why data needs to be generalizable. Your research needs to be generalizable. Now, coming to the types of research, as I was saying, your research might not contribute to clinical subjects directly, but even if it contributes to expanding the knowledge by exploring ideas, it's still research, right? And it's known as basic or fundamental or pure research, right? That is, for example, you're finding out the correlation between a certain disease and levels of certain chemicals in the body. That is basic research, but it's again very important. The second type is applied research, that is to find solutions to current problems. For example, you are doing the clinical trials of a new drug or of better diagnostic methods. That's known as applied research. Many a times when you're submitting your research or your abstract to conferences, you'll often come across these categories, and that's why it's very important to know what these categories mean and which category your research fits into. Now, there's a third category, which basically is translational research, which is not very old actually, because till a very long time, people used to think that these two areas cannot be combined. But now we've understood that we can actually convert this laboratory research more rapidly into clinical practice and vice versa with the help of translational research, right? Now, this can either be bench to bedside and back. That is, for example, you are doing some tests and you're trying to understand how to make it more accessible to the bedside, and that's known as T1 translation, that is from clinical practice to population at large, or to the community and beyond and back, that is T2 translation. Okay, that got skipped, for example. So, for example, we have the antigen test, right? In which my lab, which is a laboratory in Pune, has come up with this test, which can be done by people at home. And that's a very good example of this, that is T2 translation, where you are taking something from clinical practice to the population at large, right? Now, there are different words that you will come across when you're reading research, that is prospective versus retrospective, or longitudinal versus cross-sectional, or descriptive versus analytical, or observational versus experimental, and quantitative and qualitative. And this PPT is not meant to tell you about all of this. I'm just trying to tell you about the basics of research. And of course, if GGMC Rise allows me, I'll be happy to tell you about all this in detail. But I'm sure someone else will be talking about all this in the research methodology webinar, right? So don't worry about it. Now, coming to the steps of research, which is the end of this section, so that we can go back to the questions. This is something that I had already spoken about, right? We have gone from something that you're wondering about to a research topic. But now, how can we go ahead from this research topic? So once you have a research topic, right, and this is for everyone who went like, how do I do research? Okay, this answers that very, very simple question in as much detail as I can. So once you have a research topic, you need to identify the relevant variables, okay? Be it dependent variables, independent variables, or confounding variables, right? A dependent variable and independent variable. Let's say I need to give you an example for this, right? So age, okay? Age, weight, height are all independent variables because these are not determined by any other variable. But something like the length of a disease, okay, these are all dependent variables because they know that they are depending on certain factors, which is exactly what we are trying to research, right? So those are dependent variables. Once you have all these variables in place, you need to formulate a research design, okay? And by formulating a research design, what I mean is that you need to define the sampling technique, you need to define your sample, and you need to calculate your sample size. And the reason why defining your sample and calculating your sample size is different is because, for example, if I want to say that I want to do research in diabetes, okay, my sample is going to be diabetes type 2 patients of a certain age group in a certain geographical area. Okay, that's my sample. I'm defining my sample. But if I need to calculate my sample size, I need to make sure that I understand how many of these people I need to test or I need to include in my research to make sure that my research is generalizable, right? And that has nothing to do with how many people are already there, right? It has nothing to do with that. It has everything to do with the previous research that has been done and how you can achieve the most valid result possible. So this is how defining your sample and calculating your sample size are two completely different things, right? The second thing you need to define in your research design is the timing and the sequence of measurements. Because many a times we are trying to rush into our research and we forget about scheduling things, right? So you need to make sure that there is a schedule. Then you need to look at the intricacies, right? What are your comparison groups going to be? Is it like a case control study wherein you are looking at controlled diabetes and uncontrolled diabetes, something like that? Is there a controlling bias, right? That is there any sort of bias that can affect the result that you're going to get? For example, are the people with uncontrolled diabetes already from a lower socioeconomic status, which is just going to give you different results if that is going to be a confounding factor and that can actually be a bias. Then you have to define the data collection instruments and plan, which is quite self-explanatory. And then you have to decide the statistical analysis to minimize spurious associations. Don't get scared of these words. What this basically means is that you have to make sure that the conclusion that you're coming to is because of the factors that you say are contributing to the result. For example, if I say that uncontrolled diabetes patients have lower BMI. Okay, that's the conclusion I came to because I measured everything and that's what I found out. But now, is this a spurious association or is this a causative association? Is the diabetes mellitus actually causing a lower BMI? Or as I said, people with uncontrolled diabetes mellitus might already be from a lower socioeconomic group, right? So is the lower socioeconomic status causing the lower BMI? Okay, so that's how you understand using statistical analysis whether this is a spurious association or whether it is a causative association. And you need to define all of this before you even start with your research, because if halfway across you realize that, oh, I should have found that out, like I should have assessed what the socioeconomic status was and I never even asked them about that, and then you have nowhere to go because you've already gone through all those participants. They aren't going to come back to tell you about their socioeconomic status, and which is exactly why formulating your research design right from the beginning is extremely important. The next thing is, of course, collecting, analyzing, and concluding. And once you've concluded, your research is done, right? So the reason why I have put the collect, analyze, conclude into such a small space is because if you have everything else planned, then all of these things are super simple. All you need to have is good planning, right? I think I've come to the end of my presentation. And look at us. We've actually sat through 1.5 hours of a webinar and not slept. I hope so. And this is the end of my presentation, and I hope that you all enjoyed. Of course, if there are any questions, you can ask me now or you can text me on these spaces. I'm going to go through the chat now and answer any questions that I can. I just need to drink some water first. In the meanwhile, Sara, if you have any closing words, you can say them.
Okay. So that was definitely a wonderful session, and we are definitely taking something home from this session. And I'm sure we are motivated enough to take this first step. I can talk for myself, definitely, but I'm sure it has helped a lot of us who are just starting in this field. So thank you so much, ma'am, for sparing out time from your busy schedule and like guiding us throughout. And thank you, GCMER, for agreeing to collaborating with us. And like ma'am has mentioned the handles here, please do check out their Instagram page and also their YouTube channel and LinkedIn profile. It'll definitely help you all because there's a lot that they do and they have amazing sessions, webinars, and posts that they put out. So please do check out GCMER Instagram. Yeah.
Thank you for that shout out. But yes, on a serious note, we have a lot of videos on our YouTube, which basically just talk about these exact things that I've spoken about, how to choose a research topic, the basics of research. We also have specific things, like for example, we had a session with a cardiothoracic postdoc and a neurology postdoc, in which both of them had spoken about the neurological tools and the cardiothoracic tools that you can use in research. And I think that was really interesting. It's just one of the videos. So yeah, I encourage you to go through that before you like approach me and say like, how can I do this? How can I do that? Just go through the videos once, please. And it will really help you. I can tell you that much. This is not me selling that. We don't get any money from that. So just go through the video. It should help. How can second year students who are not able to get enough exposure in wards, regular rounds, get publish a case report? Okay, so I did my first research in second year, but it wasn't a case report, so obviously this is not the same. But the way in which you can do that is get in touch with residents. Okay, just approach residents. Firstly, if you aren't getting enough exposure to wards and regular rounds, then the question that you have to ask yourself is, are you capable of publishing a case report? Because it's not just about adding it to your repertoire, right? You have to make sure that you have the clinical approach to actually write a case report, because a case report involves you giving the background of that disease, whatever case you have come across or cases you have come across, and then describing all the things that are important in that case in that report as a case presentation. And if you are not capable of looking at things clinically, then you can't write it. But if it so happens that you are clinically sound and everything, but you're just not going to rounds because of COVID or whatever, then you can definitely get in touch with residents, make friends who are interns, make friends who are residents. Tell them, sir, ma'am, can you like tell me if you come across any interesting case? And they will tell you, trust me. Like, we demonize these seniors, like, you know, like we have to be scared of them, but trust me, if you approach them nicely, they might bully you a little, which is completely unacceptable, but that's because they have been taught like that, and we have to break the cycle. So you have to approach them humbly but strongly. Tell them, I'm really interested in this. This is a clinical field that I see myself specializing in. So can you please tell me if you come across any cases? And of course, whenever I'm writing my case report, I'll make you a co-author, or like, you know, we can all be co-authors. So all that really helps. And that's how you can, you know, get to a case report, even if you're not attending regularly. Any teacher support in college? So whenever I was talking about the entire how to choose a research topic thing, not once did I mention that you need a teacher to like tell you this or tell you that. All you need is a mentor, right? And a mentor is different from a teacher, because there are some research topics that don't really require you to do anything clinically in the college, right? You can always approach like organizations like GCMER, where you can get a mentor who can help you with choosing a research topic, doing your research. So trust me, choose your research topic first. That has nothing to do with teachers. You can always approach residents if you're wondering about the feasibility of something. They can always tell you about the prevalence of something in the college. For example, I can tell you that there is this college called SMCW, which is Symbiosis Medical College for Women. And I recently gave like a guest lecture over there, and they don't have any seniors because this is their first year. Like, this is the first year that their college has started. They don't have any mentors. They don't have anybody. And even the teachers over there are like any other teachers, right? But they are so interested in research and they are doing stuff, because they have one or two like doctors in the hospital who are very interested in research, and one of the doctors happens to be my friend, and that's how I'm helping them, because they are interested, so I'm helping them, and they've actually come up with really good research topics on their own. So you just need to have the right mindset and you can do it, trust me. Is it okay to approach a professor to publish a case report when you haven't been regularly involved in patient care for that particular case? No, I wouldn't say that. I think it's okay for you to tell them that, you know what, can I be a co-author on that with you being the first author? Then it's fine, I guess. But at the same time, when you say you haven't been regularly involved, if you have been there since that person was diagnosed with that rare thing, even if they were admitted before, whenever that person was diagnosed, from that point on you were there, I would say it's ethical to do that. But otherwise, don't just approach teachers and say that, you know what, I want to publish a case report on that when you had nothing to do with that case. That's not really ethical. I wouldn't suggest that. What are the ethical challenges in initial phases? Well, ethics is more important than anyone thinks. Firstly, most journals require you to have ethical approval. So that's the bureaucratic part of it. But the ethical challenges itself, things like anonymity, right? Many students forget that these patients are not just subjects, they are people, and saying something about those patients or people in a conference or in a publication can actually really harm them. And that's why anonymity is extremely important. The second thing is something like consent, right? Many people don't take consent when people are filling out questionnaires, right? Did you take consent from them to even publish it? You don't know that. Did you take consent from them when you are writing a case report on that patient? Because if you are mentioning such specifics like this 35-year-old male was diagnosed with blah 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 and was treated with blah blah blah, there might be some relatives of his who might be reading the journal, who are in the medical field, who might actually come across that, and that can be embarrassing for them, that can be harmful to them. You don't know that, and we as researchers or clinicians don't get to decide that. And that's why it's very important to take consent at every step. So these are the few initial ethical challenges that you might face. What is the difference between statement given in research and proof research? I don't know what that means. What is proof research? Statement given in research and proof research. I don't know. And I think Devabrata is not on the meeting right now because his name is in gray. So I don't know. I don't know what that means. If anyone has any more questions, I will be happy to answer them. Just word them a little more clearly. Honestly, like I'm very bad at like interpreting and like, understanding. Just ask me directly and I can answer it directly. Okay, I'm going to stop sharing. You can email us any queries you might have, be it for like collaborations or like as individual doubts. And you can even message us on the GCMER Instagram page. Other people do have access to it. Of course, the GCMER PR team has access to it. Just me. Access to this PPT. No, I don't think you're going to get the PPT, but you will have the recording on YouTube. So you don't need the PPT actually. So yeah, that's all. And yes, thank you everyone for attending this and sitting through 1.5 hours of this. Even I actually had like another personal engagement at 6 o'clock. My niece had her naming ceremony, but I mean, I'm going to look at a recording of that, I guess. But yeah, it was really interesting to talk to all of you. Very interesting questions. Very happy to answer them. Very happy to see enthusiasm in students. Always happy to see that. And honestly, I'm very happy to see GGMC Rise also doing this methodology webinar. And I encourage all of you to attend all the webinars. Trust me. Maybe you didn't like this webinar. Maybe I was boring or something. I'm not saying that in like a self-deprecating way, but it might happen. But that doesn't mean that all the other webinars are going to be like this, right? So try to attend it and come to us if you have any questions. We do have one more question. One question: if I'm doing research on a particular topic and eventually some research on the similar topic got published, will it be good to continue with the same project? Yes, because see, for example, during the COVID times, there were a lot of research papers being published at the same time on like healthcare workers and like, you know, COVID in healthcare workers, mental health in healthcare workers. And even I was a part of like 2 projects which were in the same field. But at the end of the day, like, yeah, we did submit it for publication because it doesn't matter. There might just be some difference. As I said, it can be a geographical location difference, it can be a temporal difference, it can be anything. So go for it. Don't worry about all that. As like, you might just feel that, you know, like they've published it, so why should I do it? But maybe your research methodology is better than theirs or anything. So go for it. Should publish it. Okay. Thank you, everyone. I'm so sorry this went on for like 2 hours instead of like 1 hour. I don't know why this always happens with my webinars. Talk too much, I guess. But yes, thank you everyone for attending. I'm going to stop sharing my screen. Yeah, okay, perfect. Okay, cool. Thank you.
Thank you so much, ma'am. And we are really very sorry you had to miss such an important thing. But thank you so much for sparing time out of your busy schedule and still like conducting the whole session.
No.
Yeah,
I don't.
thank you so much.
I'm sure this was much more interesting than that. So no worries.
It was definitely very interesting for us, and like all the queries and participation, really very glad. So thank you, audience, for staying with us till the end and also interacting. We hope we continue to get your support, and you, like ma'am said, we keep on learning and growing in this journey, and like seriously attend all these webinars so that we know at least where to start and, you know, get that motivation and that kickstart to our projects. So thank you so much. I'd like to take this opportunity to thank the PR team of GGMC Rise for taking the special effort to spread the word, and also the tech team for, you know, conducting the event so smoothly. It wouldn't have been possible without you all. And last but not the least, the entire GGMC Rise team, everyone who was involved in ideation and planning and execution. A big thank you for making this webinar a success. And thank you, audience, for joining. We'll soon announce our next webinar, so stay tuned for that. And good day. Thank you so much.
Thank you, everyone. Bye-bye.
Bye, ma'am.